Assalamualaikum warahmatullahi wabarakatuh. Okay, today I will present about total quality management. Okay, before I present my part, I will introduce myself. Okay, my name is Aimunira binti Baharuddin. Okay, I will present about introduction of total quality management. So before that, you must know what is the total quality management. Okay, total quality management is the ongoing process of identifying and minimizing or eliminating production defects. So it is a management approach that originated in the 1950, and then after that it famous in 1980. So the total quality is a description of the culture, attitude, and organization of a company that strives to provide customer with product and services that satisfies their needs. So before that, we must know what are the four principles of total quality management. So first is customer focus, and then teamwork, performance, and quality assurance. So after that, my friend will explain about four principles.
Assalamualaikum, my name is Rabiatu Adawiah binti Mustafa. Alright, now I will explain to you guys about the customer focus. The customer focus is the main principle of total quality management, TQM. So, what of definitions for customer focus? The definitions for customer focus is understand what the customer needs and expectations. It means that every customer have on their expectations for this product and the service. So, the customer focus principle also apply in the public sector. Alright, now I will explain to you guys what the factor of unsuccessful customer focus principles in public sector service. They have three factors. The first is lack of training. The employees lack of training in the workplace. For example, in hospital, the staff don't know how to serve the customer properly. Therefore, the organization must provide the sufficient training to their employees so that the quality of their service can reach the expectations of the customer. The second is lack of training knowledge. The employees don't have the skill and knowledge about the technology. For example, the staff in hospital don't have skill or knowledge about the functions and the operations of the technology. For example, they don't know how to use the computer within work methods. This will cause work to be delayed and employees will also feel unhappy. So the solution is the organization need to provide the knowledge of training how to use the computer properly. The third is hiring the wrong people. It means the staff to work in the organization. The staff don't have knowledge, skill, and experience in the position as a worker. For example, in hospital, they need the certifications and experience in medical. This is because to ensure that the staff don't easy to make mistake or negligent will giving treatment to the patients. Therefore, the organization must hire the right and qualified people with their certificate, knowledge, and skill and experience.
As we know, the definitions of teamwork refers to the interdependent performance components required to effectively coordinate the performance of multiple individuals. This means teamwork efficiency is measured from communications, coordination, unity, mutual support, and learning in a new product development project, which is NPD. So, one of the objectives of teamwork is to ensure that the patients being treated feel safe and comfortable with all the services provided under their care, which are the health workers in line with their main objective. As previously mentioned, health professionals must always work together as a team to deliver complete, continuous, and high-quality healthcare in any setting. The health sector in Malaysia, especially in hospitals, suffer from a lack of teamwork, often due to a lack of individual self-unifications. Each team members also lacks a sense of responsibilities and also self-awareness when it comes to lack of training to learn how to work together with everyone. As a result, it has made it difficult for them to understand the task given, and the lack of cooperation between them and eventually conflicts and lack of team effectiveness. This is because there is a lack of discipline training practiced by colleagues that should have started early in medical school. The healthcare sector's also concerns for teamwork is also the lack of educations, lack of disciplines, and the lack of professionalism when working together in hospital. Problem-based learning (PBL), which is an example of the best collaborative learning technique practiced by important parties such as the Ministry of Health Malaysia (MOH). With PBL, so it allows students which are in the medical schools to combine the concept they learn with the clinical component while demanding knowledge of acquisitions, common mistakes among doctors during teamwork, and psychomotor abilities. Not only that, but the situation in the operating room is also a high situation that requires a close teamwork and requires a high levels of understandings among team members when they do their work. The ability to adapt to various variations in the work environments, make flexible and open communications with team members, and anticipate the needs of each team members are all important elements of a team when working together as a teamwork. Thus, most of trainers working in the health sector in Malaysia do not receive clear training on how to use this ability in teams with high levels of interdependence and coordinations of work as a group. Due to this, there is a lack of communication due to different ideas among members, and it also affects teamwork when they work together. The effects of lack of understanding and failure to reach an agreement with each other in the surgeon's room will cause the situation to become tense and may ultimately causes the surgical process on the patient to be unsuccessful. Cases like this often happen in Malaysian hospitals, and it's not only affect the patients but also his family members.
My name is Seda Shafika, and I will explain the approach pillar of TQM principles in the public sector to achieve an efficient and good service in Malaysia. The first one is the absence of clearly defined performance metrics. In Malaysia's medical field industry, there might be a lack of clearly defined performance indicator, resulting in uncertainty and inconsistency when monitoring and assessing performance. Without specific measurements, it becomes challenging to measure service quality and identify opportunities for improvement. Another issue is prioritizing quantity over quality. In some cases, performance measurements in the medical field sector focus more on quantity rather than quality. Key performance indicator may prioritize metrics like patient volume, number of operations, or revenue earned. While these measures are important, they may not fully reflect the quality of care or patient outcomes. When the emphasis is on quantity instead of the actual quality of care provided, this approach can lead to inefficiency and subpar service. Another challenge is incomplete data collection. Accurate and complete data gathering is necessary for effective performance measurement. However, the medical field industry in Malaysia faces difficulties in data collection due to inadequate information system and incomplete data. Without detailed data, it becomes difficult to assess performance effectively and identifies areas for improvement. When different departments within a hospital use non-interacting information system, it becomes hard to obtain a complete view of patient information. This scattered data collection hinders performance evaluation. Lastly is the limited focus on continuous improvement. Performance measurement should be an ongoing process that aims to constantly improve. However, in Malaysia's medical field industry, there might be insufficient attention given to ongoing improvement. When monitoring and assessments of performance occur infrequently, opportunities to enhance service efficiency and quality can be missed. For instance, if patient wait times are only assessed annually without regular monitoring, bottlenecks may go unnoticed and unaddressed.
Assalamualaikum warahmatullahi wabarakatuh. So my name is Tur Isla binti Rosli. I will explain the last point of this presentation, which is lack of focus regarding quality. So lack of focus regarding quality is we are more focused on service because of public sectors only giving services, not giving product or selling product. So service is how to meet the quality in service. Of course, when the customer or the consumer or the clients or the human people or Malaysian satisfied with the service. So the government maybe have put a KPI to all the staff, all the government staff, all the workers in the government sector, in the government department. But how to make sure, how do we know that the service is meets the quality? For example, in the Ministry of Health or medical things, medical department, medical sector. So I gave this example, like we always in this situation, we have the wand, and the wand need to be cleaned by nurses. But how the nurse want to give the quality service, the service that have a high quality. So if she clean the wand harshly, the service is still giving the service. Okay, the ones will be clean, but the patient will feel so hurt, so suffered with the treatment. So the service that have a quality, which is she did it with a really gentle, follow the procedure and the policy. So it called the quality service that have quality. So as the government, they need to set up or develop a strategic plan to solve this problem in the public sector.
Hi, we meet back. Okay, after my friends have discussed about their part about 4 principles that I have told before this, so I must say the conclusion. What is the conclusion from all the part that have discussed before this? So the conclusion is total quality management have failed used in our services and management because of staff, and it have another part that have lack. Okay, and then the 4 principles that we have talked before this, which is customer focus, teamwork, performance measurement, and lack of focus. There are 4 principles. They have their own benefit and their own lack. Something that not suitable to use in our services and organization. So we know that this principle is failed. Okay, this principle is failed to use. So that's why our government not use this TQM, which is total quality management. So the short form is TQM. Sorry, TQM. So I think that's all the conclusion from our groups, and thank you to Madam because here our presentation. Okay, thank you.